8 people were taken to Singapore General Hospital for burn injuries after a fire at an industrial building at Tuas Avenue 11 this morning. Witnesses said they heard a loud explosion. The Singapore Civil Defence Force said on Facebook that about 65 others in the vicinity had evacuated before firefighters arrived. The fire involved an industrial mixer in the affected unit and was extinguished with 2 water jets. Its cause, though, is under investigation.
Non-executive chairman and director of Keppel Corp, Lee Boon Yang, will retire from his post on April 23rd. After nearly 12 years of helming the board, Dr. Lee will be succeeded by Danny Teo, who's Keppel's current audit committee chairman and member of its remuneration and board risk committees.
On the COVID-19 front, 7 new cases were confirmed today, including 1 in the community.
The remaining 6 cases were imported and placed on stay-home notice when they arrived here. The Health Ministry will share more details tonight.
4 F&B outlets, including Club 1 Min in Concord Shopping Mall, were ordered to close for breaching safe management measures. The second offender club was found to have allowed gatherings of more than 8 people. It also had hostesses intermingling with patrons on February 19th. The establishment was ordered to shut for 20 days. The other 3 outlets were ordered to close for 10 days after diners were found consuming alcohol after 10:30 p.m.
13 more eateries, including Shi Li Fang at Orchard Central, Rong Hua Bak Kut Teh at Waterway Point and Basil Thai Kitchen at Paragon, were fined $1,000 each for breaking COVID-19 rules. Separately, 234 people were each fined $300 over illegalities at parks and beaches, like group gatherings of more than 8 people.
The last 4 members of a 12-person group who illegally gathered on Lazarus Island last year were each fined $3,000 today. It's the same punishment the other 8 people were dealt. The British nationals pleaded guilty to a charge of meeting others for a non-permitted purpose and without reasonable excuse under the COVID-19 regulations.
In an update last Friday, some 250,000 Singapore residents have received their first dose of the Pfizer-BioNTech vaccine, and about 110,000 have completed the vaccination regimen.
Of course, this number has risen since then, with vaccinations rolled out for seniors and taxi and private hire car drivers from this week.
Now, if all goes well and there are no disruptions to the supply, Singapore can reach its aim of getting 1 million more people vaccinated by April. Singapore should be able to fully open its borders and life can start returning to normal, only if everyone who is eligible gets vaccinated and is protected against COVID-19.
If a significant portion doesn't get the jab, it can jeopardize the entire program.
The percentage of people who need to be vaccinated depends on the R0, the reproduction number, indicating how transmissible the virus is.
Let's get an expert's view with Associate Professor Alex Cook, Vice Dean of Research at the Saw Swee Hock School of Public Health. Welcome back, Professor. So, what is the present R0 in Singapore, you think?
So there are actually 2 different reproduction numbers, and I think it's important to realize a distinction between those. There's what we call the basic reproduction number, or R0, R0, and that is the amount of transmission from one person to subsequent cases in the absence of any measures to try to control transmission. There's also another kind of reproduction number, which we call the effective reproduction number. And this would typically be lower because for most of the pandemic so far, we've been making efforts to try to reduce the risk of transmission from person to person. It's actually quite difficult to know what the exact values of these are for reasons I'll explain. So in Singapore, we have always been trying to control the pandemic ever since a year ago when we first started getting cases imported in. And because of that, we've never really experienced what the basic reproduction number, or the R0, is, because throughout all the last 12 months, we've been suppressing it to a lower effective number. So for us to know what the basic reproduction number is in Singapore, we really have to look overseas and try to estimate. So if we look at Wuhan was the first place to experience large-scale transmission. And so before they went into lockdown to try to prevent the epidemic, we're able to kind of get a sense from the initial rise in number of cases as to what the reproduction number was there. We can extrapolate that might apply in the Singapore context. So the first estimates that have been made for what the Wuhan reproduction number was like was somewhere between 2 and 3, meaning that one person would infect between 2 to 3 people on average in the absence of control. Now, of course, that doesn't directly apply to Singapore because for the last 12 months, we have been working very hard and quite effectively to control transmission. And so that means that we're at an effective reproduction number, which is less than the basic reproduction number, and probably even less than 1. That's why we're seeing imported cases not leading to sustained local transmission of infection. So I would guess that the effective reproduction number right now is less than 1, but we don't know what it would pop up to when we start relaxing some of the control measures, such as safe distancing, and the other forms of safe management measures we have in place. So it may go back in the absence of any vaccination and the absence of any other control. It may pop up to somewhere about 2 to 3, but we're not quite sure at this point in time.
Professor, if the R0 is higher, it means more people need to be vaccinated to achieve herd immunity. What happens though if that percentage of people is higher than the percentage of people actually eligible for vaccination?
So if not enough people get vaccinated according to the limit that we need to reach in order to get herd immunity. Okay. So if we exceed the limit that we need for herd immunity, that means that society has become, in a sense, like invulnerable to the epidemic. We'll still see cases coming in, but there won't be enough immunonaive people, so people who've never been infected before or never been vaccinated, for epidemics to spread at that point. If we don't reach that level, right, if we're at a lower level, then that means that society is in effect still vulnerable to having epidemics. So those who have been vaccinated would probably not get infections, but those who have not been vaccinated, for example, kids, those who are not able to get vaccinated, maybe they're pregnant, they're worried about the risk to their pregnancy, or those who refuse to get vaccinated, they would then be at risk of getting infection in epidemics that could happen. So I can see these kind of two different paths that could play out if we don't reach the level of vaccination coverage that we need in order to get herd immunity. So one of the paths would be that we continue to have all of the safe management measures in place. Therefore, everyone in society is effectively going to suffer as a result of that. We won't be able to travel. We're still going to have some workplaces on split mode and so on. So that would be one of the paths that we might end up at. So if not enough people are vaccinated, then basically everyone has to continue to hand the extra safe management measures in order to keep epidemics from happening. On the other option that could happen would be that we decide that we've rolled out the vaccine, not enough people have taken it, but everyone's had the chance to get it who's eligible for it. And therefore, we decide that we would relax all of the measures that we have in place to try to prevent the epidemic. Now, if we've not reached the level of herd immunity that we need to get to, then that means that if we're relaxing all of our measures, then the reproduction number is going to pop back up again, and we're going to start seeing epidemics forming. And it'll be a bit like what it was in the first quarter of last year. Now, those epidemics would then be preferentially occurring amongst those who have not been vaccinated. Some of those people will be those who decline to get vaccinated, but others would be people who are not able to, for example, because they were too young and the vaccine's not been tested out in kids yet, or because of health issues, or they're pregnant or whatever. And so I think that it's important for those who are able to get vaccinated that they should get vaccinated, both to protect themselves, but also to prevent us from going down that route, which would expose other people to risk of getting infection.